Good afternoon, or good evening, or good morning, wherever it is, whatever time it is, wherever you are. My name is Tanya or TitaniumBuilt, and welcome to my channel. If you're a returning Titan, welcome back. If you're new to the channel, welcome for the first time. I hope you appreciate today's case coverage, and if you do, I hope you'll consider subscribing to the channel. I didn't even put any makeup on and my hair is still a mess from the shower. It's still wet, but I wanted to bring you guys these videos because we are in the midst, right in the forefront of the Letecia Stauch trial that's going on right now. If you're not familiar with the trial, we have a whole playlist. She's done it all. This lady is technically trying to fight to be insane, but if you were just wanting to talk about her, you would say she was insane, but we don't want to give her that out. So basically, Dr. Susan, this is going to be the lady, the coroner that did the autopsy on Gannon. She is going to come and testify that he had acetaminophen, also hydrocodone were found in Gannon's body during the autopsy. So hydrocodone, if you do not know what that is, it's another name for Vicodin. Vicodin is, a pain medication. That is a controlled pain medication. It's pretty hard to get. She said that she finds it unusual, which is very unusual to me. She said Letecia Stauch, Gannon's stepmother, she should have known better than to probably give that to him as a first resort medication. But she is on trial right now for allegedly murdering Gannon. But she did say that she did murder him. She's just trying to fight the insanity. She's trying to say that she was insane while she did it. So without further ado, let me go ahead and get to this video for you guys. This is, like I said, this is going to be the coroner. I can't pronounce her last name, so I'm not even going to try to. But her name's Dr. Susan. That's what I'm going to call her. And she does do a really good job on explaining how the body looked to her and what she found inside of it. Also, there was no pancreas because of the decay of the body. So trigger warning, but this is true crime channel. So going into it, you guys should know there's a big trigger warning on all of them.
Typical doctor that you perform a toxicology test as well
Yes,
when you do an autopsy.
yes.
What is the purpose of doing a toxicology report?
We do it in all violent deaths, and it's to determine whether there were any drugs or what drugs were in the system.
Was that performed on Gannon Stauch?
Yes,
Was there anything unusual detected in Gannon Stauch at the time of autopsy?
there were some drugs, or there was a drug that was present.
Okay, so let's talk first. Acetaminophen, a typical over-the-counter medication, was that found in Gannon?
Yes,
Would that be anything unusual that a child would have potentially residual acetaminophen at the time of autopsy?
if maybe the the decedent at that time was having a fever or pain, they would give them acetaminophen or Tylenol.
Would that be common though? In an 11-year-old to find that in a body potentially?
Not, you don't always see that.
Okay. What other things did you find in Gannon's bodily tissues?
He also had hydrocodone in the liver tissue.
All right, so let's talk about hydrocodone. What is hydrocodone?
Hydrocodone is a narcotic analgesic. It's a drug used for pain, and that is also found in cough medications because it's supposed to suppress your cough.
Is hydrocodone a controlled substance?
Yes, you need a prescription for that.
So I can't just go to Walgreens without a prescription and buy hydrocodone?
Yes,
Is it indicated as highly addictive?
yes, you can be dependent on it.
What are the effects of hydrocodone on a human?
Depending on the dosage, you can initially become drowsy, lightheaded, dizziness. And if you take a higher dose, it could lead to respiratory depression, or you'll have problems breathing. You'll have lethargy, coma, and eventually death.
Was it unusual, in your opinion, to find hydrocodone in a child of 11 years old like we did here in Gannon's death.
Yes, I found it unusual.
Is that because of all of those issues you just described?
Yes, and if it was for a cough, you would give something that didn't have the, narcotic analgesic in it.
I just want to point out too, the day that Gannon was sick and not feeling well, he wasn't feeling well because he had a cough. He was feeling unwell, this is the story anyway, because he had an upset stomach. So if he had an upset stomach, there's no way in hell you would give a kid hydrocodone. That's going to make their stomach pain even worse.
Typically, people would not.
Yes, that wouldn't be the first line of choice.
Okay. May I have just a moment, Your Honor?
May.
Go ahead, doctor. Thank you.
Cross-examination, Mr. Cook. Thank you, Your Honor.
Good morning, Dr. Ignacio.
Good morning.
My name is Will Cook, and I'm a defense attorney in this case. I'm going to ask some follow-up questions. Were you able to tell the blunt head trauma injuries, the three on the top of the head you were discussing? Can you tell the jury if those were post-mortem or pre-mortem?
They were pre-mortem.
Pre-mortem. And by that, you mean before death?
Yes.
Okay. At one point during your investigation, were you kind of unsure whether the blunt force trauma had happened before or after Gannon had died?
No.
Okay.
I just want to point out that she doesn't let him get anything past her in this cross-examination. Just keep your ears peeled because it's good.
And the injuries that you noted in your report and during the autopsy, they would indicate that this was a violent death.
Yes.
Okay. Also, it looked like a lot of the injuries, the blunt force injuries, the sharp force injuries, it looks like it was just a random act, whereas there's no pattern to it. You have injuries to the head, you have injuries to the body. Some are deep, some are shallow. It indicates that this was a random attack, correct?
Yes.
Okay. There was no pattern to it.
Yes.
Would the blood force injuries, were they fatal by themselves?
Yes, they could be.
Okay. And you say the gunshot was fatal in and of itself as well?
Yes.
Okay. Did the bullet from the gunshot, I can't remember what you said, did it enter into the cranial vault?
It did not.
It did not. Okay. And the mechanism for death with the gunshot, it was that it severed the spinal cord or some vertebrae?
Yes.
Okay. And what would have been the mechanism for death with the blood force injuries? Would that have been bleeding or hemorrhaging in the brain? What would that have been?
Yes, there was hemorrhage in the brain.
Okay. When you're doing investigation and autopsies and looking at toxicology reports, did you go back or did your office or did you receive any information about whether Gannon had had a prescription for cough syrup or cough medicine that contained any hydrocodone?
No, I didn't inquire.
Okay. So it is possible that he could have had a medication or a prescription from a doctor to assist with the cough.
It's possible.
Okay. And if he had had a prescription for a opiate-based cough syrup or cough medicine, then it would follow that it would show up in his blood or his toxicology results.
Yes.
Could any of the injuries noted have happened? There's evidence that there was a suitcase that he was in. He was, the suitcase was thrown off an overpass of a highway near Pensacola. Is there any way that some of the injuries could have been caused by the impact of the suitcase hitting the ground?
Like which injuries?
The blunt force trauma injuries,
No, they were on the top of the
the
head.
top of the head.
No.
Okay.
Just want to point out that it doesn't matter where the injuries are. She did the injuries. She inflicted those injuries. But I'm glad the doctor does come out. Coroner says, nope, they were on the top of his head.
In a lot of injuries, doctor, you'll see stippling or powder burns on the skin where a bullet or a projectile will enter. Did you note any of that, any of those type of injuries on Mr. Gannon?
I didn't see any stippling, but
Okay.
it's also because of decomposition. I might not be able to see it.
And that was my next question. Would decomposition, even if it had originally been there, would it make that disappear or decay?
Maybe.
Maybe. So what I'm getting at is, were you able to make any type of conclusion as to the distance the gun was from the body when it was discharged?
No.
Okay. Were any of the sharp force injuries, were any of them in and of themselves fatal?
Because of the decomposition, I couldn't really tell. I mean, when I looked at the lungs, because I was thinking it would penetrate the lungs, I didn't see any injuries, but because there was decomposition, it was hard to see. So I couldn't really tell with the injuries that went into the chest cavity.
So I guess all you can say is it's possible. Is it possible that some or one or more of these sharp force injuries were fatal?
Yes, it could be fatal if left unattended.
Okay. And it looks like in your report, you look for organs, you remove some of them, you measure the contents of fluids in different organs and that sort of thing. It looks like in your report, it mentions that you couldn't find a pancreas. Is that because Gannon did not have a pancreas or because it had just decayed to the point of being able to identify it?
Yes, decomposition.
Composition. So a lot of this stuff, a lot of the organs and whatnot in Gannon, they had decayed to the point where you couldn't identify him anymore.
Yes.
Okay. And is that typical for a body that had the history of exposure to the elements?
Yes.
Okay. Just a moment, doctor.
Is it typical, doctor?
Okay, so that was the end of the clip. Let me know in the comment section below if you like me to break down the trial clips for you guys like this, because I was going to do Lori Daybell, Valo Daybell as well. I don't want to overload you guys though, so if it's something that you're not into, let me know in the comment section below, or if it's something that you are into, and I'll keep doing them for you guys. Also, don't forget to like, subscribe, share the content. It really does help my small channel grow. I love you guys so much and have a wonderful day. Bye, guys.